Welcome back, Dr. K. I'm really excited about the topic we're discussing today, which is structural issues in infants and children, because this is an issue that affected both of my boys, and it's an issue that affects many children, especially kids with developmental issues, sensory processing issues, yet it's really poorly understood. And admittedly, I don't even understand it that well, even though it's something that, I mean, I have a cursory understanding. So I'm really excited to dive into this with you. And I guess we should just start by asking the question, what exactly are structural issues in children and how do they show up?
Great question, and thank you for having me back.
Yes, yeah.
I feel that this is a huge area that very few people know about, and it's really a tragic thing. I
Yeah.
think some of that has to do with this area of medicine is probably one of the best kept secrets in a way.
Uh-huh.
I'm sure you know the osteopaths and the people that do the body work. They're a very unique bunch of people, right?
Yes.
They're not
Yes.
always the most outgoing. They certainly don't like any kind of attention. They don't
Right.
really like being in public. So it's become this weird state where the people that know the medicine the best are actually all rather intense introverts. And
Mm-hmm.
they all kind of like doing their own things in their own little office, and
Yeah.
they never advertise. And usually people only find them by word of mouth. So
Right.
it's an area of medicine that's almost completely overlooked, which is really,
Yeah.
really sad. And that's why I'm so grateful that you're out there sharing this message and information with the world. Uh,
Yes. Yes, I know. I honestly, before we met you, um, I really had no idea what an osteopath was or what they did. And you recommended us seeing an osteopath for Hunter. And we started seeing her, Dr. Catherine Gill, who's in the LA area, when Hunter was about a year old. And the work she did with him was amazing. Yet it was also hard to understand as just a regular layperson, kind of an onlooker. I didn't always know exactly what she was doing, but the results in terms of Hunter's nervous system being much more calm and regulated, as well as improvements in his motor development, were undeniable. So we really reaped the benefits from osteopathic treatment. And as I said, I still don't exactly understand, how or why. So I think it's it's a great topic to delve into. And what I've learned from you is that oftentimes these underlying structural issues are kind of the root cause of certain developmental issues that kids have. And so when they're overlooked and not addressed, it impacts the child's ability to be able to take in or get the benefits from certain therapies like occupational therapy, physical therapy, speech therapy. And so, if parents can get a better understanding of A, what structural issues are, B, what the early signs are, and then C, how to find an osteopath who could help treat these issues, their child is going to be much better off and much more receptive to the other interventions that they're probably already doing.
yeah, 100% agreed. So let's get into it.
Yeah, okay.
So, I mean, a lot of people know of chiropractic medicine, right? You go,
Hmm.
you've got a kink in your neck, they pop it back into place, and you start feeling better.
Right.
That is probably the most superficial practice of structural medicine, if you want to say.
Uh-huh.
And structural medicine is basically people who do work on the physical body. And this is where we can differentiate the physical body, the bones, the ligaments, the fascia, which is kind of this elastic tissue that holds us all together,
Uh-huh.
and nerves and so forth. And then there's the functional side of the body, which are basically the gut, the immune system, the bloods, the brain. So all of the organs and the
Right.
internal functionings of the body. And basically the structure is what keeps us kind of together, right?
Together.
Because
Right.
without our
Right.
structure, we'd be a big blob who that couldn't move, right? We'd just be kind of sitting there like little amoebas, a big gel blob. So
Right. Right.
structure is what holds us together and allows us to move and do stuff and, pick stuff
Right.
up and so forth. We overlook the structure, right? Because everyone is so focused on treat the gut, get rid of toxins,
Mhm.
treat
Mhm.
molds, whatever fancy biomedical functional
Right.
medicine approaches. And we've kind of talked about some of those things in the past.
Right.
And it's not to say they're not important. They're very important. But
Yeah.
when you really look at it, and just from a very unbiased perspective, you look at
Mhm.
like, okay, we think about the gut, we think about the diet, we think about toxins, we think about, whatever other things.
Yeah.
Why is it that we don't think about the physical body? Right?
Right.
Like,
Right.
why is that not a part of our conversation? And when you go to
Right.
autism conferences, they talk about all of these other things. They don't talk
Mhm.
about the physical body. When you read books about anxiety, whether it's in
Yeah.
kids or in adults, they talk about all of these things. But somehow the physical body is left out of all of this conversation.
Right. Right.
And a lot of that has to do with, again, the masters in the field, the people like Dr. Gill, and there's
Mhm.
there's hundreds and thousands of them in the US and across the world
Right.
that do amazing work. They're not very good at publicizing themselves, which is, I
Yes.
think, their biggest deficit. And
Right.
this is,
Right.
again, why I'm so excited that we're talking about this. So
Right.
if you think about just from a purely basic level, like what does the physical body impact? It impacts
Yeah.
everything, right?
Yeah.
I mean, it impacts our ability to eat. So if you've got a kink somewhere in your mouth, you may not be able to
Right.
eat well. It could impact your ability to move fluidly. So I've
Right.
seen kids, for instance, that couldn't crawl or they couldn't crawl really well. And they
Yeah.
were just kind of dragging one foot or just not crawling at all. And then they go get one adjustment and all of a sudden the kid is crawling literally like within hours.
Right. Right.
Kids that weren't walking well suddenly start walking. And we don't even question these things in terms of why they happen, right? It's just like,
Right.
oh, Susie is just slow to crawl or Johnny
Right.
doesn't walk well. And we talked about the energy metabolic piece. But, if your kid has a kink in their hip, and it is
Yeah.
uncomfortable for them to crawl, they're just not
Right.
going to crawl, or they're going
Right.
to drag one leg. And these are all things that are right there underneath our noses,
Mhm. Mhm.
except we just overlook them because we don't even know to put two and two together. So
Right. Oh.
getting the body aligned, making sure there's no tension in the hips, no tension in the back, no tension in the
In the
neck,
neck.
getting all
Yeah.
of these pieces to be moving easily and fluidly is
Mhm.
critical for just human functioning.
Functioning. Right. Right. So when you are referring to structural issues in, let's say, an infant, like if a parent comes in, what are some of the first things that stand out to you as red flags that would point towards a possible structural issue? Um,
Fantastic.
yeah.
A fantastic question. So let's just look at babies that you brought up. First of all, what is required for a baby to come into the world? I mean, just think about the act of
Yes, a
delivery,
birth.
and
Right.
you as a mom know this way better than me as a
Yeah.
dad.
Right,
Uh,
right.
it's a very strenuous,
Hmm.
difficult, forceful process, right?
Right. That
Uh,
talk about something that gets overlooked and just totally dismissed. It's the birthing process. I think as a culture, especially in the US, we really take it for granted. And it's really kind of glossed over. And as long as the baby came out healthy and fine, never mind anything that possibly went wrong during the birth, it's like, oh, they emerged eventually and they were breathing and they were fine. Well, then we're not going to worry about it. Where the reality is, like you just said, birth is an incredibly complex, stressful, sometimes very traumatic experience for both the mom and the baby, and it really gets glossed over. Had two very, well, one more than the other, but quite stressful and traumatic birth experiences, but primarily with Hunter. Cruz was not as stressful, but and he was quote fine, and that was the end of it. So where when we came to you when he was about a year old, it became very clear that no, actually there were some negative repercussions that stemmed back to the birth and that were very much affecting him structurally, which was then affecting every other aspect of his development. So, okay, so back to the birth. So,
Well,
yeah, it can be traumatic and stressful on both the baby and the mom.
yeah. And
Yeah.
I love your point. So the job of the OB is to make sure the baby gets into this world without any kind of irreparable harm, right?
Right.
So they need to make sure the baby gets enough oxygen. They need to make sure that the baby is ultimately breathing. And I mean, that's their goal, right?
Yes.
Just to make sure mom has a safe delivery where nothing
Hmm.
horrible happens to her. And
Right.
ultimately they get the baby out and nothing horrible happens to the baby. And that is
Right.
the job of the OB. And, God bless him because it's actually a very stressful
Hard
job. Like
job.
I would never
Yes.
be able to do what they do.
Yes.
It's a very, very challenging job. So, from the perspective of the OB, they don't care if the baby has a kink. They don't care if the baby,
Right.
has trauma. Like for them, is the baby safe? Did anything horrible? To make sure to prevent anything horrible that will
Right.
cause irreparable harm. And if
Hmm.
they've done that, they've done their job. And
Right.
there's no one should ever question the hard work that the OBs put.
Right.
Now, when you look at it from another angle, which is if the OB has to get that baby out and they have to use a vacuum or they have to use forceps or they have to
Hmm.
use Pitocin. I mean, I don't know if you had Pitocin with Hunter,
I
but
didn't.
so how long were you in labor with Hunter?
Oh gosh. I mean, I honestly think it had started even a couple days before I even realized it. And I just thought I was having like normal cramping because I was, later in my pregnancy. It was 36 weeks. But from the time I realized I was in labor, it was probably about 10 in the morning, and I had him at 12:53 a.m. So I had gone all day and being like, wow, these cramps are really getting pretty bad. Oh my God, now they're in my back. Ooh, and then all of a sudden, luckily, I was with a group of girlfriends. And one of my girlfriends just looked at me and she goes, I don't want to scare you, but this is exactly how all three of my labors started. And I really think you need to get yourself to your OB. And I was like, check, please. And then, I fast forward to, I had Hunter that night. So, yeah, so I was in labor for a long time. When they checked me, I was at a 5.
Wow.
So and he was like coming, full speed ahead. So so it was definitely stressful, but I know for a lot of my friends, they were in labor, things seem like they're progressing, then all of a sudden kind of stalls, and it's like, okay, you need some Pitocin. And then the Pitocin really, and then a lot of my girlfriends who said, I'm really going to try not to get the epidural, whatever. As soon as they got the Pitocin, it's like, oh, no, no, no. I will take that epidural immediately because from what I understand, the contractions come on so strong.
Yeah.
Yeah.
Yeah. So,
So,
uh, I mean, I've heard of people describing. So, if you could imagine the amount of force that a car tire has to withstand with a
hmm,
full load on it, so
yeah.
that's a lot of pressure, right?
Yeah.
There's an equivalent amount of pressure being put into the baby, especially if there's Pitocin, to just push them
Right.
out. So
Right.
there's a tremendous amount of force. And if any of the moms had what my wife had with our daughter, she was given Pitocin for almost 24 hours before my daughter got out. So
Wow.
if you can
Yeah.
imagine those massive contractions with all that force
Mm,
for
mm,
18 hours, 24 hours, sometimes 36 hours, just
right.
push, push, force,
Right.
force. That's a lot of force
Yeah.
into a little human being that
Right.
is
Oh my
getting
gosh.
squeezed through this canal and out into the world.
Right.
Now, some babies do great. With all of that, they pop out, they're doing fabulous, they're
Right.
comfortable, they're feeding well, everything is great, and there are no issues.
Yeah.
Then there are those babies like my daughter who, from the moment she was born, she was
Mm,
just colicky and
yeah.
irritable and crying. And we were just
Mm,
bouncing her and rocking
yes.
her. And like she
Right.
was just not consolable.
Yeah.
And that is actually one of the first red flags
Mm,
that there is probably some kind of subtle trauma, no broken bones, nothing that's
right.
obvious, no big bruises. So you can't see
Right.
it,
Right.
But when you start looking and asking why the hell do some babies essentially are born with colic, and then
Yeah.
some babies do absolutely fine, and then at 2 or 3 weeks of age they get colic, and that colic
Right.
is actually more related to the
To the
digestive tract.
gut.
So
Yeah.
babies who get colic around 3 weeks, that's usually a food issue. Mom is eating something that doesn't agree with them. The babies that
Right.
are essentially born and get colic within the first few days of life,
Yeah.
they actually have some kind of trauma that's throwing off their system. Now,
Yes.
how do we understand this trauma, and how do we make sense of that? In a very, very simplified fashion, let's do an exercise together. Let's
Okay.
both just take a big, deep breath in.
Okay.
Do you feel more calm?
Yes. It
How do
always
how
feels
do
good to
you
do that.
how do you get that calm? How does that calming effect happen with that big, deep breath?
Activates your parasympathetic nervous system,
Yeah,
and that creates an overall calming effect.
that's exactly
Yeah.
right.
Yeah.
So when we take a deep breath, we pull our diaphragm down. And as our diaphragm gets down, it gets pulled down. It actually activates this nerve called the vagus nerve.
The
And it's this
right.
big fat nerve. And if anyone's curious, they can just look it up. It's this
Yeah.
big fat nerve that takes all of this signaling from the gut, the diaphragm, all the different parts of the body, and actually goes up into the brain. And
Uh-huh.
it is basically the master rest and relaxation nerve in the body. It is probably one of the most important nerves that helps us achieve a state of calm. And again,
Right.
a simple way to understand this is when you take several deep breaths, that calming effect is actually the effect of the vagus nerve.
Mm-hmm.
And I
Mm-hmm.
equate the vagus nerve to essentially the braking mechanism of the
System.
brain. It's what
Yeah.
creates a state of calm. And the sympathetic fight flight is kind of the accelerator. And then you've got the parasympathetic or rest and relaxation, and they're constantly balancing
Right.
each other. When
Right.
you have a nice state of balance where they're both kind of at equal tone, we call it equal
Yeah.
activity,
Right.
you have a great state where you're not sluggish or sleepy, but you're not
Right.
anxious, and they're just constantly playing off of each other, and this gets activated, then this gets activated, and you've got perfect kind of mental state.
Balance.
Now,
Uh-huh.
if the brakes of the car don't work, so imagine you're driving and suddenly you push on the brakes and the brakes don't work, that would
Yeah.
be a disaster, right? It would
Right.
be a catastrophe because you'd crash. The
Yeah.
baby who's born who is colicky essentially does not have effective braking mechanism of the brain. The brakes don't
Right.
work, and so you got the sympathetic tone way
Right.
up here, the brakes barely working, and you
Yeah.
get into this essentially anxious hyperactivated state. And when you look at what
Right.
colic is, what is colic? The baby who cannot calm,
Yeah.
right? The
Yeah.
baby who you have to do gymnastics
Oh,
and all
yes.
of this crazy
Yes.
bouncing, shushing. What does all of that do? It actually overrides their nervous system to calm them down.
Right.
Except you constantly have to do it because the baby has
Yeah.
the inability to do it
On
themselves,
them. Yeah.
right?
Yes, and you're describing Hunter to a T. So I'm just so I'm flashing back to sitting on our yoga ball at home. Just I that yoga ball was like attached to me and just bouncing, 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 bouncing. And
Mm-hmm.
and then like you said, the second you stop, I stop and finally, oh, okay, good, he's asleep. Try to put him down. The second I, move him up again, screaming, back on the yoga ball, bouncing, bouncing. And like there was no reprieve. And we had the exact same experience as your daughter where I've said this several times and it is not that funny of a joke, but you have to look back on these things and laugh a little bit. But my joke is that he came out screaming and he never stopped. And like that is really what my first couple years of motherhood, I mean, it got dramatically better after we met you. So I would say for the first year of motherhood, it was like I had this child who seemingly never stopped crying. And if the only time he would not cry is if I was doing something to soothe him or if he was on me. So I mean, he practically lived in those little baby carriers, and that was the time where he could really regulate because he was, regulating with me. But if he was left to his own devices, he was quite a mess. And so the implication there that you're describing is that there is a nervous system that's really out of balance, and what is potentially part of the mix that is often not looked at is the vagus nerve and its ability to be activated to get the parasympathetic nervous system to balance that out. And sometimes when there is a structural issue that stems from a traumatic birth, it can impact the vagus nerve. And from what I understand, it's like these kids, like Hunter, are thought to have like low vagal tone, if
Exactly.
that's
You
correct.
nailed it.
Yeah,
You
yeah.
nailed it. That's perfect.
Okay, good. So
You've
yeah.
earned your PhD in
Okay.
vagus nerve.
Yes, I've done a little bit of research now to understand it better. But
Oh,
and
that's perfect.
yeah. So so you we started off saying like one of the red flags are these babies who are born, and from birth, from a couple days after being born, they seem inconsolable, and
Yeah.
they're maybe having trouble feeding. Every time you nurse them, they're not calming down. You lay them down to change the diaper, they're still crying, and it takes a lot. You're jumping through all these hoops to soothe your baby, and that is not typical. So,
It's not optimal.
yeah,
And
okay.
this is where parents can start looking to see if this is their kid.
Yeah.
And I would say probably about maybe 20%, 30% of the kids that I see have this history where there was a
Hmm.
traumatic birth or a very prolonged birth. There was a lot of
Hmm.
pitocin, baby came out, and pretty much from day one was colicky. And
Right.
for people who want to do their own research or their own reading, there's actually a really cool book called the healing power of the vagus nerve.
Uh-huh.
And then there's another book called the polyvagal theory that kind of talks
Okay.
about this. So there's a lot of information out there in terms
Right.
of this entire discussion around the vagus nerve. Now, we're kind of oversimplifying it because it turns out that there's a lot of nerves. So
Yeah.
when you have a traumatic birth, you basically get a kink in the back of your neck.
Right.
And the vagus nerve comes out of this hole. We call it a foramen. So basically, you got a hole that's, I guess you can see it, about that
Yeah.
big. And then there's a bunch of nerves, including the vagus nerve, that are coming out. If there's
Uh-huh.
any kink in that hole, if there's any kink in the bones around it, if there's any kink in the fascia, so
Mm.
the nerves are ultimately surrounded by the saran wrap that keeps them all together and keeps them all kind of
Right.
nicely organized, if you want to
Right.
say. If there's a tension in that for a weird reason that I still don't totally understand, the book gets into it in detail and I still can't totally wrap my head around it, but it
Mm.
actually causes a dysfunction in that nerve where the nerve signaling does not fire appropriately.
Right.
And that is essentially what happens. Now, a lot of these kids also have issues with some of their other cranial nerves. So there's
Uh-huh.
actually
Uh-huh.
12 cranial nerves that come out of the base of the skull, and they
Right.
go into the eyes, they go into the ears, they go into the mouth.
Right.
And one signal or sign that there is also an issue is some babies have a lot of gagging. So as soon as you put the breast in their
Yeah.
mouth, they gag
Mm-hmm.
even though they don't
Mm-hmm.
have a tongue tie. So
Mm-hmm.
there could be other manifestations outside of this colickiness that comes
Right.
along with this kind of structural imbalance.
Right. Right.
Now, if you kind of look at things and look at, for instance, if you were in a car accident, right, and you crashed your car into something,
Mm.
does the car just magically re-expand? No.
Right.
If you were in a car accident, your car is permanently damaged, right, until
Right.
they go and fix it.
Fix it. Uh-huh.
We somehow think that the human body is able to magically resolve whatever tension that came into it.
Right.
So when
Right.
you look at, like, for instance, a rubber band, a
Mm-hmm.
rubber band you can pull and then it'll kind of snap back. But what if that rubber band, you stretched it and it stayed stretched?
Mm-hmm. Mm-hmm.
And essentially, the fascia are these plastic tissues that hold energy, so they don't just magically go back
Go.
to normal state. The bones, they
Right.
don't magically pop back into place. So that trauma that was there from birth, in
Mm-hmm.
some actually, again, could rebound from it and everything pops back into normal and
Right.
everything is perfect. In
Right.
some kids, that same pattern that was there from birth actually does not ever really go away. And that
Right.
is why, if you've got a 6-year-old or a 10-year-old that has weird anxiety and they're constantly in this fight flight, And then you go back and you're like,
Mm-hmm.
holy moly, this kid has always been like this from birth.
Right.
So they were the 1 year old that was still kind of having some mood issues. They were
Yes.
always the poor sleeper. This is one of the things
Yes.
that parents say, like, yeah, my kid has
Poor
always
sleeper.
been the poor sleeper from birth.
Uh-huh.
They're the kids that have tantrums. They're the kids that never really do well in terms of regulating themselves.
Yeah, a lot of
And
separation anxiety.
uh-huh.
Yeah, yeah,
Yeah.
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 Um,
So a picture starts emerging when you start putting the pieces together. And that's
mm-hmm.
really the cool part of this. You know, parents can
Yeah,
see themselves if this is their kid or not, because
right.
it's a very obvious pattern. This isn't something that we make up. It isn't applicable to everyone, but I'd say about
Yeah,
30% of kids that have anxiety and mood issues, when you look back,
right.
it's like traumatic birth, colicky from day one,
Right.
poor sleeper always, and now they're 10. And somehow we forget that this 10-year-old and their newborn self are
Right.
all the
The
same
same.
human being.
Right.
You know,
Right. Right.
the body didn't, I mean, the body is grown, the child has changed in terms of how
Yeah.
they look, but that
Yeah.
same trauma, that same tension, that same issue could
Is
still
being
be with them now.
yes. And I think that is something that's really hard for people to understand. Um, the idea that our bodies hold trauma, that our bodies hold it's an energy that is stored in our bodies, and like you just perfectly described, it doesn't just magically release itself on its own. The trauma really can get stuck in the body, and when that happens, it can cause dysfunction in so many areas. And the amazing thing about it is that it's not rocket science to release that trauma. That there are specific interventions that osteopaths and craniosacral therapists are trained to do that can really help the body release that tension and go back into a state of homeostasis and find that balance, which is amazing. But I think that idea is a little like esoteric, like, okay, the body stores trauma. Like, what does that mean? It's
Yeah,
hard
yeah,
sometimes for us to grasp onto those things when they're not super tangible.
yeah. So
Yeah.
let's first just look at the storing of trauma. I don't know if you've ever been in a car accident. Hopefully not. I'll share with you a story of mine. This was years ago. Gosh, probably 12 plus years ago.
Uh-huh.
I was with my brother and sister-in-law. I was sitting in the back of their car. We just on the freeway actually came to a dead stop because there was
Yeah.
some kind of traffic jam in front of us. And the car behind us, for whatever reason, decided not to stop. And at like 45, 50 miles an
Oh
hour,
gosh.
basically slammed into the back of our car
Oh my
and
gosh.
just basically demolished the rear end of the car. Fortunately, we were all safe. We came out of the car, and the next day, like I was literally immobilized, like my
Oh
back,
my
my neck,
gosh.
like everything. I was just moving hurt.
Right.
And I'm sure people, whether they've taken a bad step and gotten a
Yeah.
sprain in their ankle or lifted something and all of a sudden got, some kind of kink in their back where you're just like, oh,
Right.
and
Right.
that kink in the back, depending on how bad it was, or the ankle sprain, depending on how bad it was,
Yeah.
like it gets better, but the same function never comes back, right?
Mm.
Um, Force is force, and when it goes into the body actually holds that energy. So
Mhm.
um,
Mhm.
again, like the car analogy, that energy
Yeah.
that destroys the back of the car actually was retained into the body of the car.
Right.
And the same thing happens with the human body. The energy doesn't go through us, it actually hits our tissue, and our tissue actually takes some of that energy. And
Right.
ultimately, that gets converted into torsions and
Mhm.
tension
Mhm.
and other problems.
Yeah.
Now, that tension is ultimately, what can cause the vagus nerve to have issues.
Yeah.
Children can have kinks in their back, in their pelvis. It can affect other nerves and how that
Uh-huh.
communicates the different muscles. And this is
Uh-huh.
where the osteopaths and, the gifted cranial sacral people take it to a whole other level.
Right.
Now, Uh, I'll give you my own example of what
Yeah.
happened. So I went and saw this friend of mine who's a master osteopath, and I have to say I think they actually do shoot rockets to the moon because technically I'm an osteopath, I'm a DO, and I
Right.
sure as hell cannot do what they do. Like these
Yeah.
people are friggin' talented, and same thing with
Gifted.
the cranial sacral people, like the people that are just really into it.
Yes.
And just like what you described, with Dr. Gill, where she put her hands and said, wow, he is a footling breed. I
Yeah.
can't do that,
Right.
and
Right. It's a
I would venture to
gift.
guess a lot of other people, like, they don't have that degree of touch. And that's one of the first gifts that these people have. That
Right.
one, I truly think they're gifted, and their ability to use their fingers to actually
Uh-huh.
sense stuff is just totally different than most other human beings.
Yeah.
And then on top of that, when you spend tens of thousands of hours practicing, training, it's like the pro athlete. Every day,
Yeah.
all day, they train. They're gifted to begin with. And
Right.
then when all that training, you take it to a whole other
Next
level.
level.
And in a sense, that's what these people are. They're gifted, and then they perfect their sense of touch to the point where,
Right.
like with that same guy that I used to work with,
Yeah.
or that treated me for the car
Yeah.
accident. I was a student, and that's how I came to know him. And I saw him
Uh-huh.
once, and I remember vividly. I was treating one of his patients. I was on the patient's ankles, and he was on the
Yeah.
patient's head. And then, 2 minutes into it, he's like, "Did you sprain your ankle?" And I was on the ankle. I was holding the ankle.
Yeah.
I didn't feel a darn thing. Like that ankle
Right.
felt okay with me. And then the
Right.
patient is like,
Right.
yeah, actually, 2 weeks ago, I stepped off the curb and I really sprained my ankle and it really
Yeah.
hurt. Thanks for noticing. They
Yeah.
hadn't mentioned anything. And every
And
day,
he
similar
felt
things
into
would
that
just come up.
somehow.
What's that?
Yeah, sorry. Like he felt into that somehow by
Yeah.
where he was touching the person's neck or yeah.
So,
It's
I mean, when we
fascinating.
look at that, everything in the body is connected, right? It's not
Yeah.
like the ankle is floating in space
Right,
disconnected from the
right.
body.
Yeah.
There's tissues that ultimately connect everything to the body together.
Yeah.
And these guys or gals are so talented that with the touch of their hand, they can actually feel a weird pull that goes in the direction of,
Yeah.
for instance, the ankle or the diaphragm or
Right.
wherever. And that is what's so incredible about what they're doing. They can literally create almost a three-dimensional map of the
Yeah.
entire body without
Right.
touching the entire body.
Right.
And that same guy that I talked about, with his name is Dr. Dolgen, that treated this lady's ankle.
Yeah.
When I got into that car accident, literally I was completely immobile. And I called him
Uh-huh.
up. I was like, please see me. So he sees
Yeah.
me the next day and treats me for an hour and a half. And I kid you not, within 24 hours, like all of my physical pain was just completely gone.
It's
Like I had
amazing.
full function, everything was moving,
Yeah.
everything was back to normal. And that is what their work is so cool, because they
Right.
don't pop bones back into place.
Right.
They
Right.
don't, do any kind of crazy movements. When you look at them, you're like, this is a friggin' joke, because
Yes.
literally their hands are just sitting. And
They're
I'm sure you saw that.
barely, yeah, they're barely touching. I mean, it doesn't look like they're doing much of anything. So it, as an onlooker, it can be a little bit of a leap of faith of like, okay, I'm trusting that this doctor, with Dr. Gill, she was you gave this amazing referral, and she had, you know, years and years of experience. I mean, and so I trusted that she knew what she was doing, and she did, but I remember, Hunter was seeing her like every couple weeks. And at one point my husband was like, so what is this treatment? And I just felt like I looked like a deer caught in the headlights. I'm all, I don't really know. And of course, my left brain engineer husband was like, what do you mean you don't know? Like, what is she doing? And I remember I said, you kind of have to just come and be there, and then you can ask questions as she's going along. But I'm telling you, Hunter, every time we go, he is crying when I lay him on that table, and by the time we leave, he is asleep in my arms. And I don't know what exactly she's doing, but whatever it is, it's working. So it but from an onlooker's perspective, you do kind of wonder, okay, what are they doing exactly? on the other hand, it's very safe.
Yeah.
I think sometimes the field of like chiropractors can kind of get a bad rap, and maybe people have had, an experience or something that wasn't great, and they are kind of popping and doing things. But an osteopath, there's nothing popping going on. It's just
Yeah.
very gentle touch that I think that can be very reassuring to parents that if you are seeking out treatment, this is not something that is going to be, in any way potentially harmful to your child. It's a very safe method of treatment.
Yeah, yeah, and I'm so happy that you highlighted that because I think that that's one of the worries, that they're going to take
Yeah.
the young kids up to someone and they're going to do something, weird. I think the only weird part about it is that it looks like they're literally doing nothing. So
Yeah.
I've had multiple families that are like, I thought this was the biggest frigging joke and
Yeah.
the most royal waste of my money until all of a sudden my kid that hasn't slept, in two
Right.
years suddenly is sleeping through the night.
Right.
And one, I would say, if in terms of finding someone, just
Hmm.
as we're kind of touching on this, if you
Yeah.
go to someone and they're about to pop your kid's neck, that's where you say, "Stop, thank you so
Yes.
much, have a nice life," and you walk
Right.
away.
Right.
These treatments should be so absurdly gentle that it literally looks like they're doing nothing.
Exactly.
And the other part of this, I think that, in terms of just gauging how well these things work, if the treatment is right for your kid, I'd say within, would you agree, like 2 sessions, you should start noticing things shift?
Absolutely. Absolutely. Yes, right. I mean, we saw a a difference right away, especially with the sleep. In the beginning with Hunter, that like I said, he after the treatments would be so relaxed that he would fall
Mhm.
asleep, and he was one of those babies that did not like to be in the car seat and would cry in the car. And I would be able to transfer him to the car seat and he would stay asleep the whole way
Wow.
home. I mean, it was
Wow.
quite remarkable. And I want to share this too, because this is one of those things that really stuck in my mind. It's like this memory that's seared in my mind. I, during one of the sessions, I was explaining to Dr. Gill that he had never been able to like reach for his toes or pull his toes up to his mouth, like how babies do that.
Hmm. Hmm.
And I had
Hmm.
noticed all the babies in our little mommy and me group, all the babies moved their bodies like that. They would kind of just reach down, pull, or bring their legs up, grab their toes, and kind of pull their toes up. And Hunter had never done that. And he would primarily just lay on his back and stiffen up his body really tight and then relax and then stiffen up. And that's kind of all he would do. And so as I was explaining this, she was treating him, listening to me, and, doing her thing. And I kid you not, I have the chills thinking about this. She goes, she said something like, "Oh, there we go." I remember her, and I was like, "Oh, okay." And all of a sudden, his legs come up, he grabs his toes, and
Oh,
he pulls his toes to his
no
mouth.
way.
I started bawling. I mean, I
Aw.
literally have the goosebumps. It was crazy. I mean, at that point, I was like, I am a full blown believer. Whatever this woman is doing, I don't know how to explain it to August, but this woman knows what she's doing. And that was just remarkable.
Mm.
And Hunter did have a lot of, he had issues in his hips. He had a lot of overt structural issues. Like his hips were internally rotated, and then from his knees down, his legs were externally rotated. He walked with a
Mm.
severe in toe. He had a lot of stuff going on, and the treatment was just remarkable. And now, he's 8 years old now. And we did a lot of therapy. It's not like he had one treatment and it was some magic, solution. No, Hunter went through a lot. We did physical therapy, occupational therapy. We saw an amazing woman, Nancy Dilger, in LA, who specializes solely in gait and works with children. And she ultimately got Hunter in orthotics. But for a kid who literally was walking with his feet all the way turned in, I have videos of this poor little guy when he first learned how to walk. He's 8 years old now. You never in a million years would know. There are zero signs of any of these structural issues.
Mm.
It's just amazing. And I should post I'll have to do an article and post this, but I have this great picture of him when he was about 2 years old, and you can see the structure of his legs from the hip joints down. They're internally rotated, and then from the knees down, externally rotated. And you can see
Wow.
it so perfectly.
Wow.
And and now when you look at him, there is no sign of that whatsoever.
Wow.
It
Wow.
is just amazing. And that was very much a function of the osteopathic treatment that he received through from 1 year. I mean, we saw Dr. Gill for about a year. We moved to San Diego, and there's an amazing osteopath down here in Coronado. Marianne Morelli Haskell is her name. And Hunter did about a year of treatment with her. Um, so, he had extra stuff going on. So he, I think, required possibly a bit more than maybe some kids would. But the results were just have been remarkable.
That's awesome. That's
Yeah,
awesome. It makes me
yeah,
so happy to hear this. And I think that that's the cool part of this. There's so many things that are possible when you start opening up this other door. And
yeah,
all of these conversations we're having are basically options and treatment tools, right? It's
right,
not right for every kid, but for the
right.
kid who needs it, it can be a borderline miracle.
Yeah,
And I
yeah.
think having awareness of osteopathy and cranial sacral work, and there are plenty of cranial sacral therapists that are massage therapists,
Hmm.
chiropractors who are super, super talented. And for any of your audience members that are, abroad, there are osteopathic non-doctors that
Right.
also do great work. And
Hmm.
when you start searching, you'd be surprised by who may be in your own backyard who is doing really, really
Yeah,
good work.
right.
I think to help people kind of put things into context in terms
Hmm.
of the things that you described with Hunter
Yeah.
is if we can imagine having little kind of plastic elastic bands going all
Hmm.
throughout our body, and these plastic elastic bands are basically what keep us together. They keep our bones attached, and we have ligaments, but
Right.
in addition to these ligaments, we have fascia. So it's almost like saran wrap that goes around our muscles and connects
Hmm.
everything and ultimately keeps the human body together, keeps our organs in the right place. And everything is ultimately wrapped in this kind of plastic saran wrap that has a lot of ability to kind of uh,
Stretch and
handle
yeah,
tension.
yeah.
And this plastic wrap, this elastic tissue, actually connects the top of our skull all the way down to the base of our feet.
Right.
And through that connection, everything ultimately gets intertwined. So, tension in your
Mm.
shoulders, for instance, can
Right.
throw off or could be due to something in your hips, which could be from something in your
Right.
ankle. And
Right.
one of the things that's really amazing about these osteopaths, and for people to kind of look at it in this sense, because I'm sure there are people asking, like, how the hell do they barely touch the body? And through
Yeah.
that barely touching the body, do they produce these kinds of borderline ridiculous sounding,
Miracles. Yeah.
miracles? And,
Yeah.
and I think for most people, when they hear this, they're like, this can't be true. Like, this is
Yes.
all a hoax. This is all a joke. It can't be real.
Right.
And I think that that is one of the things that has actually kept this field of medicine from becoming mainstream,
Hmm.
because there are a lot of naysayers that are like, no, this is not possible, even though they've never experienced it for
Experienced it.
themselves.
Right.
But if you imagine all of these little plastic bands that
Hmm.
can hold tension are
Hmm.
all
Hmm.
interconnected, and there's someone who's talented enough to be able to basically feel that tension in these elastic tissues
Yeah.
at multiple different levels. And because they've done it for so long, they've basically created little mental maps of like, okay, if the ankle is sprained and the ankle is pulling on the back of the neck, so they're
Yeah.
feeling it from the back of the neck. They're not on the ankle, but they're like,
Right.
oh, this back of the neck and this band of plastic tissue is pulling in this way, and it feels like it's coming from, you know, 6 feet, 4 feet down,
Right.
and it kind of has this twist, and it's weird. They can actually feel twists, they can feel
Yes.
pulls, like
Yes.
they're and they've described this to me because they're like, can you feel that? I'm like, no,
Right.
I literally can feel these forces, and these forces all
Yeah.
exist. I mean, if someone just sits back and thinks back to basic physics, presuming
Hmm.
we took basic physics, but
Hmm.
think about basic physics, and they talk about force, coming in, and ultimately that force has to do, something has to happen with that
Right.
energy.
Right.
So from a basic physics standpoint, there could be torsions, twists, they could be
Yeah.
pulls, they can be compressions. So
Right.
all of these forces is there, and these people can actually feel that.
Yeah.
And by giving essentially tiny little tugs, and that's what they do, they either push or
Right.
pull on the elastic tissue in a absurdly precise fashion. And that's again why, like, I would never claim to be even semi competent in doing this,
Right.
because I have no idea what the hell I'm doing, and I'm an osteopath.
Yeah.
But
Yeah.
these guys can feel the pull, and they're like, okay, if I put literally 2 millimeters of force, basically enough as like someone would feel as a light touch, and I pull in this direction, that will pull this tissue in this way, which can actually cause that tension, that
To
torsion, that
release.
turning to actually
Yeah.
release. Because
Yes.
when you pull on something the right way, all of a sudden that tension just
Yeah.
opens up.
Yeah.
And that's essentially what they're doing. And they're doing it at a whole body level. So
Mhm.
they go from
Mhm.
head to toe. And
Yeah.
at every level, they're like, okay, is there tension here? Let me release this. Let me release the
Right.
diaphragm. And by releasing the diaphragm, I can get better movement of the intestines, because it
Yeah.
turns out the diaphragm is sitting right on top of the stomach, for instance. And
Right.
for babies who have tension in their diaphragm, they reflux,
Yeah.
because that
Yeah.
sphincter doesn't work well, because the diaphragm is constantly coming up against it and
Mhm.
causing it to lose its patency, if you want to
Right.
say. So that's essentially what these osteopaths do, these
Are
craniosacral therapists do. And it's really, really incredible as an asset and tool for someone to have for their kid.
yeah.
Because I think, just again, at the super superficial level discussion, if they can get that vagus nerve to be working,
Yeah.
that alone causes the kid to just enter into a better state of calm
A
and relaxation.
regulation.
And
Yeah.
circling back with my daughter, so we had about, I think, 4 days of just constant fussing, constant crying, just kind of like
Mhm.
what you described with Hunter, constantly
Yeah.
bouncing. Like, we were just taking turns at night. I would sleep 2 hours,
Right.
I would be holding her, then my wife,
Right.
would be
Oh.
holding her,
Yeah.
so forth. And once she got a treatment, it was weird. She went from essentially not sleeping for more than an hour, hour and a half,
Mhm.
especially if we
Mhm.
weren't holding her, to suddenly
Mhm.
doing 4 hour stretches. And she became literally the dream baby overnight. It was the most
Wow.
freakishly weird thing that I'd seen in a long time.
I know we've talked in the past, and you said, structural issues certainly can start from birth, but a child can have a totally non-eventful, uneventful birth, and but have an injury, later in childhood, have a really bad fall, or be in an accident, or and those kind of things can also cause structural issues. But when it's stemming from a traumatic birth, the kind of picture you gave is the birth. And actually, I wanted to mention when we were talking about this earlier that a traumatic birth doesn't just mean the overt traumas that we associate with, like these very scary, terrifying births that thank God the child was okay. But a traumatic birth can be a C-section. Like a routine C-section can be a traumatic birth for a child. A
Yeah.
traumatic birth can, being a breech baby, that can have an impact. Getting stuck in the canal, or, having, what's the word I'm looking for? The meconium, swallowing meconium, or, there's all these different things that ultimately, the baby is fine, but that they really can constitute birth trauma. And so, if that was the experience, prolonged labor, vacuum delivery, forceps, emergency C section, lots of Pitocin, I mean, there's all these
Yeah.
things that can fall into that category. And then the baby was born and is inconsolable from within the first few days of life. Just a baby who's crying all the time, having difficulty feeding. The pediatrician is saying, "Oh, it's your baby just has colic." So the word colic is used like from the get-go,
Yeah. Yeah.
versus your baby is born and he or she is fine, and then several weeks down the road, they start becoming fussy. That kind of colic is, like you said, more associated with maybe something the mom is eating and the intestinal tract. But when
Yeah.
it's from the get-go, and then the baby has trouble sleeping and is a bad sleeper. And then maybe a little bit down the line is having reflux. Would you say that motor issues are part of that picture as well?
Mhm,
Um,
mhm.
so,
Yeah. So, it's really interesting to look for the patterns. And again,
yeah.
this is really what I urge everyone to do, to
Hmm.
look to see if this is your kid.
Yeah.
The kids that start refluxing at around 3 weeks of age, and that has to do a lot with the change in the bacteria of the intestinal tract and just the maturation of the intestinal tract. That
Hmm.
is almost always a dietary sensitivity where mom is eating too much dairy, wheat,
Okay.
fill in the blank, and that's causing the kid to not be able to digest those foods.
Hmm.
The kids that were spitting up from early on, and the other thing that's remarkable is most of the kids that have digestive related reflux, so food
Yeah.
related reflux,
Yeah.
usually by the time they're around 4, maximum 5 months of age, their reflux has gone away
It's fine.
because their intestinal tracts have matured.
Gotcha.
If you have a 9 or had a 9 month old that was still spitting up, or a
Hmm.
1 year old, and I see this in the history of some of the kids that are still spitting up,
Right.
that is way weird. And that
Right.
is almost always a structural issue.
Structural
And
issue.
when you think of the stomach, so there's the stomach that's kind of
Hmm.
sitting below our chest, right? The
Hmm.
top of the stomach has the sphincter, which is this muscle that should be keeping the content of the stomach inside.
Uh-huh.
When there are structural issues, so there are nerves that can actually control the sphincter tone, the
Hmm.
diaphragm itself is sitting right on top of that sphincter. So if the diaphragm is at all kinked, that kinking can cause the sphincter to not be tightening appropriately.
Right.
Any of those issues basically cause the sphincter that doesn't work to then cause it to be unable to keep the content of the stomach
Uh-huh.
down. And that's why you can have a 1 year old that still spits up, or
Spitting
the
up.
9 month old that still spits up every
Yeah.
time they get into a weird position.
Right.
That is a sign of a structural issue.
Uh-huh. Uh-huh.
Um, I love, just to kind of go back, I love what you touched on with the C section, because
Mm.
that is actually a really important point for us to kind of go
Right.
over. The birthing process. So, in the ideal world, there's a nice, relatively easy birth. Mom pushes for, let's say, 6 to 10 hours,
Uh-huh.
baby goes through the canal, easy delivery comes out, and that contraction. And then all of a sudden, if you look what happens
Yeah.
when they come out, they take that big deep breath, and
Mm-hmm.
things, their diaphragm, actually part of their skull, actually compresses and then re-expands. When
Uh-huh.
it re-expands appropriately, all of that tension from the
Is
birth actually is
released.
released.
Yes.
If there's the vacuum, if there's the forceps, that's one way that they get tension, or tons and tons of
Yeah.
pitocin, or they're just stuck in the birth canal for hours, and
Right.
that's when you get the weird cone heads, right?
Right.
Those are all signs of tension that was beyond kind of what the birthing process can handle.
Right.
But if the kid doesn't go through the birth canal,
Mm-hmm.
so they're
Mm-hmm.
actually taken out via C-section for whatever reason, they don't
Right.
go through that natural compression and re-expansion. So whatever tension they had by sitting in the womb,
Yes.
you look at the womb, it's
Yes.
not necessarily the most, abundant, spacey
Right.
area, right? The kid is kind of in
Right.
this little compressed, funky
Yes.
form, because that's all that, especially in the later stages of pregnancy, that's all the room that there is for them.
Right. Right.
If they can't get that expansion or compression and re-expansion, that actually causes the child to have retained trauma
Mm-hmm.
or tension within their body. And that's
Mm-hmm.
kind of why you touched on the fact that that could be
A
another reason for it.
C-section. Yes, yeah. So even a healthy routine C-section can have repercussions for a child. And like you said, some kids, it's not to say that every child born of a C-section every parent should rush out to see an osteopath. That's not the point. It's some kids are totally fine and they are more resilient for a variety of reasons and they're able to go through that process and be okay, but other kids like Hunter aren't.
Yeah.
And it's when you take in like all the whole context. We're not looking at just one isolated thing. We're looking at a pattern. And really, what I have learned is that it's the pattern very much points to a nervous system that is just very dysregulated. And so you're trying to like peel back the layers and see, okay, what is contributing to this dysregulation? And the structural piece is a piece that is very likely contributing for a certain population of kids who sort of have this certain pattern.
Mhm.
And when it continues to just be kind of overlooked or not paid attention to, that child might be receiving three, four different kind of therapies and not getting that far.
Yeah.
And so these are the kids, or for the parents listening, if all of this is really resonating, um, you know, this those are the kids that you kind of want to rewind, and look at the whole story and say, oh my gosh, this sounds like a piece of my child's puzzle. Let's maybe put a hold on PTOT and get an evaluation from an osteopath and do a couple treatments and see where we're at. Because treating those structural issues and releasing some of that stored tension or stored trauma in the body can really open the child up to being so much more receptive and just um, helping their nervous system be more regulated in
Yeah.
general,
Yeah.
which is obviously, makes a big difference in the child's functioning.
Yeah. And I think that's the key part. If the parents are like, "Oh my God, this is my kid," and
Mm-hmm.
a lot of this is ringing true for you, then chances are your kid has this issue.
Mm-hmm. Mm-hmm.
If it's not, then maybe this isn't applicable to your kid, and that's
Yeah.
that's really the most important part. You have to understand your child, and it's
Okay.
one of two things: either all of these pieces or most of these pieces ring true, and you're like, "Oh
Mm-hmm.
my God, yeah, my kid did have a complicated delivery. Oh my God, yeah, we had
Mm-hmm.
to spend hours rocking him or her early on.
Yeah.
Oh my God, yeah, they had this. Oh yeah, they had that." And if the pieces line up and the
Mm-hmm.
pattern matches what your child has experienced in their life going all the way back, then
Mm-hmm.
go get them a treatment. If it doesn't, then chances are this isn't necessary for you.
Right.
uh,
Right.
I, I love what you touched on in terms of other things that cause trauma. So it
Yeah.
isn't just birth trauma that can
Mm-hmm.
ultimately scramble things and cause tension.
Yeah.
I'll give you an example of a recent patient of mine. There was a sweet dear family of ours that got into this horrific car accident. Car flipped over. I mean,
Oh.
it was just when I looked at the picture that they sent me of the car, I'm
Oh
like,
my
oh my
God.
God, like,
Yeah.
thank God you were able to walk away from this because
Right.
some people would not. The dad reached out to me about a month after the car accident, and what he said is, my little girl, the 7-year old, is acting weird. I'm like, what do you mean? He's
Mm.
like, yeah, she's just kind of all over the place. I'm like, what do you mean?
Yeah.
And he's like, she's not focusing, she's not paying attention, she's not doing her piano, she's having all of these issues, she's kind of anxious, and I'm like, oh,
Mm.
that's weird. Tell me more. And
Yeah.
mind you, this little girl was, for a 7-year old, highly, highly focused, high
Right.
achieving,
Right.
playing the piano well, like doing all
Yeah.
of these really remarkable feats that were not uh, that were impressive. So all
Yeah.
of a sudden, she had a pretty significant loss of function. And then we kept talking. I'm like, okay, so tell me more. He's like, yeah, when she used to love the piano and now she hates playing the piano and actually is not playing it nearly as well as
Mm.
she was before. I'm like, okay, tell me more. How is her hand-eye coordination? Yeah, yeah, she's just kind of clumsy and bumping into things, and she used
Interesting.
to have pretty good hand-eye coordination and doesn't. It like started painting this picture. I'm like, holy cow!
Yeah.
The accident caused trauma that essentially uh, caused the disorganization of her cranial nerves. So think
Mm-hmm.
about what controls the eyes, and we're just
Yeah.
talking as one example. Ultimately, they're
Right.
muscles that move the eyes around,
Mm-hmm.
right?
Mm-hmm.
And these
Mm-hmm.
muscles are controlled by our cranial nerves. So the
Uh-huh.
cranial nerves send signals to the muscles, which then tell the eyes, like, okay, move left, move right, move up, move down, move this way,
Mm-hmm.
move that way.
Mm-hmm.
If there's any subtle, and we're not talking major, it's not like suddenly she had a lazy eye. I mean,
Right.
thank God there
Right.
wasn't anything horrible like that. So when
Right.
you when dad was looking at her, she looked fine.
Right.
But if you think about how precise vision has to be for tracking to be perfect,
Mm-hmm.
even a millimeter of distortion. So if one eye is even slightly off from another,
Yeah.
and that's what vision tracking errors are, right?
Right.
For families whose kids have trouble reading, they
Mm-hmm.
skip lines when they're reading.
Mm-hmm.
They may be super, super smart in some areas, but they're
Right.
like 3 grade levels behind with reading
Right.
or math, because math is also very, very visually
Visual.
demanding.
Uh-huh.
If your kid has these issues, chances are they have a what's called a visual processing disorder, which is basically they can see fine. They can see if you ask them to look at a chart, they can see
Right.
the numbers on the chart. So it's
There's
not that
not it's
they
not the
can't see.
acuity. Yeah, so there's
Exactly.
nothing wrong. The acuity is good. It's
Exactly.
what how the brain is interpreting what they're seeing.
It's how partially the brain is interpreting, but it's actually what the eyes are sending to the brain
Uh,
when the eyes are going back and forth. So playing the
yeah,
piano, I mean,
yeah,
there's a lot of eyes back, scanning back and forth, looking at all the keys, right? When we're
right.
reading, eyes are going back and forth. When
Yeah.
we're walking into an environment, right, our
Mm-hmm.
eyes are
Mm-hmm.
constantly scanning the room to see where all the objects are. If
Right.
one eye does not track perfectly in symmetry with the other. So if one
Right.
eye, it's almost a lazy eye, but not to the point where you can actually see it.
Right.
If there's even the slightest error in how the eyes move, all of a sudden, 3 dimension is distorted. So
Mm-hmm.
that you don't see objects in normal 3 dimensions. Some
Right.
kids that, for instance, have toe walking, they toe walk because they bring themselves up a certain way, and that's because with them, how they track, how would it planes, where basically we
Uh-huh.
look at the
Uh-huh.
floor and the floor to us looks completely flat. For
Right.
these kids, the floor may actually be tilting away. So what they do is they actually toe walk, so they bring their heads up. So now
Interesting.
the floor actually looks level to them. That's a
Uh-huh.
tracking error. If there is any kind of trauma to the skull, especially the cranial nerves that control the movement of the eyes, that
Right.
can actually create a tracking error. And there's a whole world of
Uh,
neurooptometry where these guys, for instance, in the football players and the
mm,
massive head traumas that they get,
yeah.
these neurooptometrists actually focus on traumatic brain injury and all of the
Mm,
visual errors that come from that. And for anyone that wants to just look up traumatic brain injury vision error, there's a ton of articles and a lot of work in that field that come
right.
to do this. So let's say it wasn't as bad as a car accident, but your kid
Yeah.
was riding their bike, their scooter, helmet on, they crashed into a tree.
Yeah.
And then, like, your kid was fine, and then suddenly started developing anxiety, suddenly started developing learning
Yeah.
issues, suddenly started developing all of suddenly.
Right.
That was
Right.
actually the trauma of that force that
Right.
caused essentially the equivalent of birth trauma in the babies.
Right.
It's really
So
cool when you start looking at these pieces. And I've had a bunch of kids that were like, fine, boom, some kind of physical trauma happened. They crashed into something with full
yeah.
force, and then
Yeah.
something changed.
Right. Right. So potentially, if that's the case, then a child like that can go to an osteopath who's trained and skilled and working in pediatrics, get some treatments, and it can release the tension and restore the body back to balance.
Most of these kiddos, because certain other parts of their visual processing centers within the brain are also at that point kind of scrambled. So
Mm-hmm. Mm-hmm.
usually these kids need the osteopathic treatments to kind of release the tension, and then they
Yeah.
need to go see a specialized optometrist. So these are
Uh-huh.
developmental optometrists, or some of them
Yes.
are neuro optometrists.
Uh-huh.
And both of these types of optometrists, what they do is they actually look to see how the eyes are tracking,
Yeah.
and then they give parents, for instance, exercises to actually
Mm-hmm.
correct the tracking issues.
Yeah.
Sometimes the kids actually get these glasses where it has a slight prism, so it actually
Mm-hmm.
changes the angle of the sight. So
Yeah.
now everything actually lines up correctly instead of being skewed.
Yeah. Yeah.
Really, the coolest thing is the change that the kids have. I don't know if you noticed, like, change really quickly with Hunter, but I've had families where the kids that were literally like 3 grade levels behind,
Mm-hmm.
they
Mm-hmm.
they get their glasses or they start vision
Oh,
therapy, and then
yeah.
within like 3 months they're not only at grade level, they're reading sometimes above grade level, to the point where the
Yes.
teachers are just like, we have no idea what the hell is going on.
Right.
We don't know how it's possible that your kid is advancing this quickly, but it's freaking
Yeah.
cool.
Yeah.
I've had kids that had like, outright anxiety disorders.
Mm-hmm.
They
Mm-hmm.
get their glasses on, and then within weeks their anxiety disorder is gone. Why? Because the
Yeah.
kid could not actually place themselves in space. I mean, if you can
Mm-hmm.
imagine how nerve-wracking it is, where you never know where your body is in space. You're constantly crashing into things. So
Right.
these clumsy kids that we call them, the
Mm-hmm.
ones that are really clumsy, and every moment they're crashing into a wall or a piece of furniture or
Right.
whatever else, or going up and down stairs for them is an act of God. Like,
Right.
takes an act of
Right.
God. Like, it
Right.
takes them 15 minutes to go down a set of stairs, and the parents are like, what the hell is wrong with
Yeah.
you? Like, why can't
Yeah.
you just go? Well, if you can't see where your foot is going
Mm-hmm.
to be landing,
Mm-hmm.
or every time you come to take a step, every time you come to move your body, like you crash into something, because
Right.
where you think things are in space is not where they actually are.
Right.
That actually causes a profound, I mean, like, I can't stress this enough, it causes a profound degree of insecurity, because
Mm-hmm.
the world is not safe. I mean, literally,
Yeah.
at the end of the day, the world is not safe, and you're living
Yes.
like in this weird, distorted world where objects essentially pop up at you out of
Right.
nowhere. And
Right.
when the kids can see for the first time, and all of a sudden, like, they understand, like, oh, the floor is actually there. Oh,
Yeah.
that table is actually, oh. And as that reorganization happens, and it's really quick, within
Mm-hmm.
weeks,
Mm-hmm.
all of a sudden, like, a version of the child opens up that wasn't there before. And
Right.
to me, that's really, the most miraculous part of these conversations that we have. That,
Yes.
with
Yes.
some of these things, with osteopathic or craniosacral treatments, with
Mm-hmm.
these vision therapy, with the metabolic things that we've talked about in the
Yeah.
past, you dial in the right piece for that child,
Mm-hmm.
and then
Mm-hmm.
it's like a switch goes off, and
Yeah.
within days or weeks, all of a sudden, boom, a different version of the
Yes.
kid pops up, and now their level of functioning, their
Mm-hmm.
mood, their engagement, completely different.
Changes.
And I mean, that's what just, tickles me to death, because when I
Yes.
see these kids suddenly open up and they're doing things they weren't doing before, they're happier, they're more calm.
Yes.
And
Yes.
it was a matter of just tweaking their vision. Like,
Right. It's
every
amazing.
time it's a miracle for me to see, and like, it never gets old.
Oh my gosh, I can only imagine. Yeah, and with all the families you work with and seeing, having all these stories and seeing all these kids with these remarkable changes and how it impacts the whole family,
Mm-hmm.
because it really does. It's not just about the one kid. I mean, that child is part of a family, and when a child is struggling, the whole family feels that. And so when there's a shift, it really, and I'm saying this from firsthand experience in my own family, it really impacts the whole dynamic of the family. And we have had that with Hunter, and there's been so many pieces of his puzzle. And with each piece, things got better and better. And our most recent piece was the metabolic issues, and treating those, and that opened up exactly what you're talking about. Just
Mm-hmm.
this whole new part of him emerged, and it's just been incredible. It really has changed the whole dynamic of our family, and the stress level is so dramatically lower than it
Oh,
was. And just our level of being able to just enjoy each other and experience joy as a family is so much higher than it was before,
oh,
where when he was really struggling and we were all struggling, to try to figure out like how to help this poor little guy. So we have certainly experienced that. And for families out there, there is no silver bullet. Every child has their unique story. There's no one treatment that's going to magically cure everything. But as you are able to kind of dial things back and really zoom out and get a better sense of your child's story and their history, and then from there, um, take it step by step. And you don't want to try everything all at once. You don't want to just start shooting arrows in the dark and hoping something sticks and makes a difference with your kid. And it can be very overwhelming for parents. And what you have done, Dr. K, which is it's just amazing, and you're still in the process of creating it, but you've created Wholistic Minds, which is a place that parents can come and you can go there right now and take a quiz that is a 5 minutes of your time, and it will give you an idea of whether or not your child might have some of these issues: a structural imbalance, a metabolic imbalance, hormonal issues, gut issues, or sensory issues. And it will kind of give you a little bit of a baseline. And up on the site right now are some wonderful resources. And what's coming down the line is a system where you'll be able to get a very strategic game plan for your child's healing, and have a better idea of, like, okay, here is my child's story and here's my child's picture. Where do I start? What is the best place to start? And then after that, what do I do? And essentially, this is what you are creating with Wholistic Minds, this incredible artificial intelligence to help parents navigate through this often just totally overwhelming process of trying to figure out how to help their child. And what you're doing is just really streamlining it for parents, so that their kids can have these breakthroughs like Hunter has had. And we've had just the incredible fortune of being able to be your patients and work directly with you. And now through Wholistic Minds, people all over the world can have that same opportunity, which is just amazing.
Well, thank you for that. And you know, uh, uh, that the part that drives me is kind of what I touched on. Watching each child blossom is basically a miracle,
Yeah,
and
yeah,
I really want to make that accessible for everyone. And one, I mean, there's no way I could possibly work with every family, and two, it's just because of the time it takes, it becomes costly.
yeah,
So
yeah,
Holistic Minds kind of erases all of the barriers, and
yeah.
for the system that could be very inexpensive, we can make all of this information available. And as your families have been watching, there's patterns that we keep describing. If
Mm-hmm.
your kid has
Mm-hmm.
this and this and this, they probably have this. And
Right.
basically what I've done over the last 10 years is gotten very good at identifying patterns,
Mm-hmm.
and through these patterns, I've been able to pick up where the issues are. And now
Yeah.
what we're doing is basically teaching a computer to learn how to pick up these patterns by asking exactly the right question.
Right.
And our goal, and hopefully we can get there fairly quick. And by the first of the year, we should have our first prototype up, is really to help parents start seeing these issues. Because
Mm-hmm.
once you understand the issues that are there, and you understand why they're happening, and you
Mm-hmm.
understand the pieces that are coming together to cause those issues,
Yeah.
and then you find, like, okay, I need to go find a vision therapist, I need to go see a cranial sacral therapist, I need to
Yeah.
go give my kids some metabolic support. As
Right.
all of those pieces come together, then all of a sudden, like you touched on, the most miraculous, or seemingly miraculous, I should say,
Yeah.
breakthroughs come about, because
Mm-hmm.
all of a sudden the kid can see for the first time.
Yeah.
All of a sudden, for the first time, the kid has enough energy to function. For the
Yeah.
first time, their inflammation is down, which can then improve their mental capacity.
Mm-hmm.
So,
Mm-hmm.
our goal is to help parents find exactly the right treatment for their child, and to figure out in what order and priority to implement those treatments to
Right.
get the best and most effective
Outcome.
results.
Yeah.
And another part of Holistic Minds that's kind of cool is I've been fortunate to find some really smart experts. So, for instance, Dr.
Yeah.
Gilda, you touched on, she
Yeah.
actually did a big old interview for us that
Amazing.
gets into the nitty gritty details of osteopathy. I've
Uh-huh.
interviewed two. two different neurooptometrists, actually two, I forget,
Yeah.
specialized optometrists that get into, what is vision therapy and how does that affect the child's functioning. So
Mm-hmm.
it's not
Mm-hmm.
just you answer some questions and we throw something at you and you're
Right.
gone. It's creating an educational base around it so you can really
Mm-hmm.
understand what these things mean. And then the future iterations is for us to actually create a resource pool so you can hopefully find someone in your own backyard that can help you
Yeah.
implement the suggestions that we're going to be giving. So
Right.
I really hope that this really takes away any barriers that family will have to, one, understand why their kid is suffering, and
Mm-hmm.
two,
Mm-hmm.
then figure out what to do with it.
Yes, and getting I love what you said about like the right treatment at the right time,
Mm.
because those two things are so important. If you if you go to an occupational therapist, and your child is evaluated, and yes, they need OT, but your child has these kind of undiagnosed or overlooked structural issues, that therapy is not going to be as effective. So it's getting and knowing what the right therapy is at the right time or in the right order for your child. So whether your child is someone like Hunter or like Dr. K's daughter, who it started from birth or from a traumatic birth, or that seems to be the stem, and then they kind of followed this trajectory of the inconsolable baby, trouble feeding, trouble sleeping, possible reflux, maybe some motor delays, even if they were minor. Um, what can families do? Like, so say I'm living in, a suburb of Chicago, and I'm watching this video and I'm going, oh my God, that is my child. So
Mhm.
what is my next step? I'm going to Google pediatric osteopath, in my area, and or look for a referral to an osteopath. Is
Yeah, so I'm happy to share with you a link. So there's actually a place called the
great.
Cranial Academy.
Okay.
The Cranial Academy is actually a organization of osteopaths that focus on this kind of treatment, which is cranial osteopathy. And within that database, if someone puts in their zip code, they'll find a hopefully competent, practitioner not
Right.
who's not that far away from them. One key part of that database is to ideally find someone that does the osteopathy, that the manual medicine,
Mm-hmm. Mm-hmm.
90 to 100% of the time, because there are some people listed. Like at one point I was listed and I should not even be there. I don't know
Right.
how I
Right.
got
Right.
listed, but like I had 0%, right? Like 5%.
Right.
You do not want to see me.
Right.
Something like
Right.
this.
Right.
So you want someone that is highly, highly focused, and pretty much all they do is live, breathe, eat this kind of medicine.
The manual osteopathy.
Manual, yeah. A typical consult with an osteopathic doctor runs anywhere from 300 to sometimes $500-$600. Some of them take insurance, and
Mm-hmm.
in
Mm-hmm.
certain areas, whether it's PPO insurance or whatever else, you may
Yeah.
be fortunate enough to get that kind of a person. Some of them are cash. So the osteopathic physicians, generally speaking, one, I would find them through the Cranial Academy, because that means
Okay.
that they're actually certified by this organization and they've had a
Okay.
certain degree of training to do this work. And through that, then again, if you find someone who's 90 to 100% focused in that medicine, that
Mm-hmm.
automatically tells you that they're probably uh, very specialized in this and they're fairly competent. When I would
Okay.
call is, one, make sure that they see children. And quick question you can ask, even if your kid is older, like, do they treat infants? If they treat
Yeah.
infants, and also asking like how long they've been in practice.
Yeah.
If someone has just come out of school and they're a year or two in,
Right.
they may still be able to do good work. But their degree of experience is also very telling in
Limited.
terms of the outcomes that they can pull off. Like
Right. Right.
Dr. Gilda you mentioned, or this guy, Dr. Dolgen, that I mentioned, they have
Yeah.
almost 20 plus years of experience, 15
Right.
plus years of experience, and that actually produces better outcomes.
Right. Right.
For the cranial sacral therapist, so the
Yeah.
other search you can do is
Just
for
for cranial.
cranial sacral cranio, so
A-N.
CRANIO, cranial sacral,
Okay.
SACRAL therapy, or
Okay.
cranial therapy. So these are massage therapists chiropractors. Some of them don't really have, even some PTs, OTs sometimes do this. So they can have all kinds of different walks of life.
Backgrounds.
Some of them aren't really licensed, some of them are licensed. Chiropractors are actually medically licensed. So
Right.
you can get cranial sacral therapists from all walks of life. And this is where things get a little bit more tricky because there isn't a standard
Yeah.
licensure, there isn't a standard, approval process.
Right. Right.
Um, and that's where if you find someone and you're like, oh, cool, there's a cranial sacral therapist in
Right.
my backyard. First thing is, what are people saying about this? And this is
Yeah.
where I think the reviews of other people is actually very important,
Right.
because if they have really poor ratings, you probably don't even want to go down that road.
Yeah. Yeah.
When you call them, that's when you ask, like, okay, do you treat infants?
Yeah.
Yes. How long
How
have they been
long?
in practice?
Mm-hmm.
That will be helpful.
Mm-hmm.
You know, and then you can say, I think my child has a, tension, they have birth trauma, whatever you want to say. And then
Yeah.
you can ask their office staff, so can you just tell me generally how the doctor or person treats it? And if
Right.
they say, yeah, the doctor, like, you can ask them specifically, like, do they pop any joints? Do they do any of this? And they're like, yeah, the doctor believes in popping all the joints and that
Right. Right.
really helps. That's probably where you say, okay, thank you so much. And
Yeah.
that's kind of the end of the conversation.
Right.
If the person, and sometimes the cranial sacral therapists, especially if it's a massage therapist or something like that, they're actually
Yeah.
answering themselves and they're like, no, I kind of do more up ledger work. And these are
Right.
kind of terms where it's more of a massage and so forth.
Right.
And they happen to have pretty decent ratings or reviews where other
Yeah.
people that have taken their kids are like, wow, my kid is so much better.
Right.
That may be a person to go. And the upside is usually these people are much less expensive. So you're looking at
Right. The
somewhere
cranial.
around $100, $150 for the
Right.
initial session and sometimes less for the follow-ups.
Yes. And I have a personal anecdote around that. Before we saw Dr. Gill and before we met you, through our doula, and this might be a good resource for parents to go through if you've had a midwife or a doula. Often that community is very well connected to cranial sacral therapists, a lactation specialist. Through our doula, we found a woman in Los Angeles who was a lactation specialist and a cranial sacral practitioner. And we started seeing her, I think Hunter was maybe 6 or 7 months.
Hmm.
Oh gosh, I wish I could remember her name. I know her first name is Ellen. She was this amazing, amazing woman. And I had a wonderful referral through a doula who'd sent many families, had gone to her with her own infant. And so I, trusted her and she was incredible and really helped out. So that might be another potential area
Yeah.
to get
Yeah.
referrals is through a
Yeah.
doula or a midwife, or if you've gone through a birthing center, often they have a lot of those types of referrals as well.
Yeah. Yeah, and even if you haven't used them, you can reach out to, a local birthing center or find a
Absolutely.
midwife and say, hey,
Do you have a
weird
referral?
question to ask you, but do you know this type of a therapist?
Right,
And
right.
I think one thing to ultimately also for people to walk away from, if within one or two sessions you're not seeing something that is at least somewhat significant or noticeable, I mean,
Yeah,
I wouldn't expect everything to get better, but you're like, oh yeah, my kid is sleeping a little bit better, or they're a little bit more calm, or they're doing something that they weren't doing before.
right,
If after, let's say, 3 sessions at the most, you've seen no changes, that means one of two things. Either one, your kid didn't need the treatment in the first place and you should
right,
stop wasting your money, or two, you found someone that doesn't know what they're doing, and you shouldn't have to go 50,000 times to get something to happen.
right.
So if
Exactly.
someone says your kid will need 40 treatments twice a week
Right,
for
right.
X number of months before I get something to happen,
That's a
that's
no.
like someone coming and seeing me and say, I'll be like, well, let me just try enough times to hopefully get something to happen.
Right, right, right.
That should
No.
not be the case. That should
Right,
not be the case. Two or three
right.
sessions max for something to happen.
Yeah. So I think the first place parents need to go right now, if you're watching and this is resonating, go to Holistic Minds right now and just take the quiz that's on the site. It will give you a good baseline. And part of the outcome, it determines There's 5 areas that it looks at, and one of them is structural issues. So if you take the quiz and you get a result at the end that says 100% structural issues, then research an osteopath. But Holistic Minds has a ton of information up there already, and is a great resource to just head to right now. If your child has, like Dr. K said, had reflux well past their infancy, eating issues, vision issues, or had some kind of accident where afterwards, their functioning was different, then these are all the kind of red flags to pay attention to. Take the quiz, and then if it comes up, yes, there are structural issues, this is a great place to kind of rewind and go back to. I would say for families, and I know there's so many out there because I hear from you guys all the time that when I share my story about Hunter, you're saying, "Oh my God, that's my kid. That's my kid. That's my kid." Then if that is your kid, then there is a really strong likelihood that there is a structural imbalance that's part of your child's picture that once it's addressed can really open up a lot of doors for your child, and hopeful for all the families out there. And even for the families who are so hopeless right now. I was you, and I did feel so hopeless for a long time. And I have an 8-year-old son now. Oh God, I'm going to start crying. Okay, hold on. um, I could not have fathomed like how Hunter would be thriving as an 8-year-old when, oh, sorry, when I was the mom of him when he was 2. And I had so much fear for my little boy who was struggling so much. And now to see him, it's just, like I said, I could not have fathomed the transformation and just how far he's come and how well he's doing and what an absolute joy he is. Now, don't get me wrong, he has his moments, but he is a joy, and I would not change one single thing about him. Um, and, this is what I've experienced with Hunter is available for all families out there. And I'm just so grateful to you, Dr. K. I mean, for what you've done for our family, but just for your generosity and your passion about helping families and children heal. It just like thank God for you and the work that you're
Oh,
doing, and I just am so grateful. So
it's my absolute
yeah,
pleasure, and I keep going back to I know what some of these kids go through because at some point I had my fair share of experiences,
yeah, yeah,
and seeing a child suffer is never pleasant, and for me, knowing that I've helped even one kid,
yeah.
just knowing that Hunter is better, it gives me such a sense of fulfillment,
Mm-hmm.
and that
Mm-hmm.
alone is worth everything. And
Yeah,
I think the cool part is we live in a time and age where we have so much more understanding of human functioning.
yeah.
This understanding hasn't sadly trickled into regular pediatrics. It hasn't trickled even into areas of holistic medicine.
Right.
But these understandings and pockets of information exist.
Mm-hmm.
And if
Mm-hmm.
you can piece together things that are relevant to your child and
Yeah.
understand why your child is suffering, there's always an explanation. That
Yeah.
I don't believe kids freaking out and having anxiety attacks and learning issues and whatever other labels we give them, that
Right.
those things are just coincidental. There's
Right.
always a reason.
Yeah.
We just need to be able to understand what that reason is.
Mm-hmm.
And that is really my purpose, to help parents understand what are the reasons that cause their kids to freak out, to fall apart, to be in a state of chaos.
Yeah.
And hopefully, by understanding these reasons, then they can take action to address them.
Mm-hmm.
And
Mm-hmm.
once we do that, and when the right steps are taken, just transformations are mind blowing, and it's
Yeah.
it's the most beautiful thing to see children blossom into their
Yes.
true self. That
Yes.
the person that they're actually meant to be, not the chaotic, anxious mess that shows up
Right.
when they're not well.
Right. 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 Oh, well, this is
Mhm.
amazing. I, again, can't thank you enough. And for everyone listening, please go to Holistic Minds and look at the information that's already up there. There's more to come
A
very
lot more to
soon.
come.
Yeah, a lot more to come. It's in the process of being developed even further. But sign up for the newsletter too, so you can stay abreast of all the developments, and hopefully we'll continue these conversations.
Yes, absolutely.
Okay. Okay, great. Thanks,
Okay,
Dr. K.
be well.